Many across the world may well be tired of hearing about COVID-19, but the virus still has a lot to say. That's why Avat, the African Vaccination Acquisition Trust, has officially launched its no-fault compensation scheme for COVID-19 vaccines in 41 participating African and Caribbean countries. The scheme seeks to encourage trust in COVID-19 vaccines by ensuring people they would be protected if anything serious were to happen. But with just 10% of Africans vaccinated against COVID-19, there was concern among the team behind the scheme that compensation for the public may be met with even more apathy.
First and foremost, we assure the public, as has the World Health Organization, the vaccines are safe. But with like any medicine, any vaccine, there is a risk that a small percentage of the population might suffer an adverse effect, whether it's because they have an allergy or a pre-existing medical condition. Even when you think of simple household medicines like Panadol or Nurofen, painkillers that you get from the pharmacy, they all have risk warnings. We just don't think about it. So with any medicine, there's a small risk that a small percentage might suffer. What makes the COVID-19 vaccines different is that governments are asking people to take it for their own personal benefit, but the benefits of their community. It's important that as many people get vaccinated as possible. So the no-fault compensation scheme should be seen as an added insurance. The vaccines are safe. But if you are in that tiny percentage of people who suffer an adverse reaction, there will be compensation. You will be taken care of.
Avat acts as a centralized purchasing agent on behalf of the African Union member states to secure the necessary vaccines and blended financing resources for achieving Africa's COVID-19 vaccination strategy. It's already secured more than 200 million doses of COVID-19 vaccines, which have been rolled out since the third quarter of 2021. Each time a country buys a vaccine through Avat, it pays a levy. That's supported by a $2 billion Afreximbank fund.
Manufacturers actually required that entities, countries buying the vaccines put this in place. But for Africa, it was not easy. You have 55 countries and some are small economies and all that. So it was becoming a challenge. So we had to work to put in place a continent-wide framework, a whole of Africa framework, to make it possible for those who wouldn't have been able to do it. Because without it, they wouldn't have had access to vaccines in the first place. Now, what that says then is that this no-fault compensation scheme is specific to the Avat procurement of Johnson & Johnson vaccines as it is today.
Nigeria has already been receiving single-dose Johnson & Johnson vaccines.
I know that the decision has been made to make Johnson & Johnson their priority vaccine because it's a single-dose vaccine. So this would help immensely in their approach, the approach they're taking today, because it provides the government the cover. It makes sure the government is able to tell the citizens these vaccines are there, that you're also protected.
It's a three-step process. An applicant would have to have been suffering from an adverse reaction as a direct or probable result of an Avat procured vaccine for at least 30 days. Thereafter, a free application would be made, and finally, an assessment. Successful claims of up to tens of thousands of dollars would be paid promptly in US dollar or an applicant's local currency. Avatclaims.com, the website created for this exercise, is live with information on how to submit the form itself, as well as program information and a help page. For so long, there was the belief that African and Caribbean lives weren't as important. The inoculation process across the African continent and across the Caribbean islands has been comparatively slower than the rate of that happening in more developed countries of the world. But with the coming of the Avat no-fault compensation scheme, the message is clear. African and Caribbean lives matter. They are important. They are worth insuring against the worst that could ever happen as it pertains to COVID-19 vaccines that have been purchased directly from this scheme. Adefemi Akinsanya, Arise News, Abidjan.